Imagine this, which is a common scenario I see as a GP. You're sitting in mid-surgery and the doctor tells you you've got type 2 diabetes. It must feel like the floor's been taken from underneath you. People feel overwhelmed, confused and scared. The doctor may hand a prescription and tell you this will help you manage it, but nobody really tells you what you really want to hear, which is that you can reverse it. For decades, people with type 2 diabetes have been told that their condition is permanent, that it will only get worse with time, that they'll need more medication, insulin injections, and to prepare for complications like heart disease, kidney failure, or even amputations. It's no wonder that people feel hopeless. But what if I told you that this narrative is outdated? That type 2 diabetes is not a life sentence? That it's absolutely possible for you to reverse it and take back control of your health? And this isn't just a theory, it's a reality, and I've seen it happen time and time again. My name is Dr. Nerys Frater. I'm an NHS GP and founder of the Lifestyle Clinic. I created this clinic because I was frustrated by the limitations of the 10-minute NHS appointments. I wanted to provide people with the time, the education, the support they need to make a real lasting change to their health. Over the years, I've helped hundreds of people just like you, reverse their diabetes and reclaim their lives. And today I want to share with you how this is possible, why it's such a groundbreaking discovery, and how you can take the first steps towards your own health transformation. But before we dive in, I want you to take a moment to imagine what reversing diabetes could mean for you. Picture waking up in the morning with energy, without worrying about blood sugar highs or lows or medication schedules. Picture feeling confident in your body and in your own health. Picture knowing that you're in control, because that's where we're working towards ultimately. So let's take a step back for a moment. Not so long ago, type 2 diabetes was seen as a chronic, progressive disease. Doctors believed there was no way to stop it, let alone reverse it. It was treated as a condition that could only get worse over time, leading to complications like heart disease, nerve damage, and those amputations. Patients were told to manage their symptoms and hope for the best. And this belief has shaped how we approach diabetes for decades. Medications were developed to manage those blood sugar levels, but they didn't address the root cause of the problem. And the message that patients received was clear. This is your life now. Avoid all of life's treats, restrict sugar, and avoid all temptations. And it's no wonder that so many people feel helpless and powerless. But then something incredible happened. Advances in science began to challenge this old way of thinking. Researchers discovered that type 2 diabetes isn't just about high blood sugar. It's about the body's ability to process sugar. And it's a process that can be restored. And what's even more amazing is that this restoration doesn't require endless medication or surgery. In fact, it actually comes down to lifestyle changes that anybody could make. So let me repeat that. Anyone can make these changes. It doesn't matter how long you've had diabetes, how high your HbA1c is, or how many medications you're on. Your body has an incredible ability to heal when you give it the right tools. And that's what makes this discovery so groundbreaking. For the first time, we're not just managing diabetes, we're reversing it. Now, I know that might sound too good to be true, so let me explain what reversing diabetes actually means. Reversing diabetes doesn't mean the condition is gone forever. It means that your blood sugar levels are back in the healthy range without the need for medication. And we measure this using something called the HbA1c, which gives us an average of your blood sugar levels of the past 2 to 3 months. A normal HbA1c is below 42. With type 2 diabetes, it is 48 or higher. So when we're talking about reversing diabetes, we're talking about bringing that number right down below 48, even below 42 through lifestyle changes. And when you do that, something incredible happens. You're not just lowering your blood sugar, you're reducing your risk of complications, those heart attacks, kidney damage, and nerve problems. In fact, lowering your HbA1c by just 1% reduces your risk of complications by 21%. And that is huge. So even if you don't want to reverse diabetes completely, every small improvement matters. It's not about perfection, it's about progress. And that's something I want you to hold on to as I continue. Every step forward is a step towards better health. Now, you might be wondering, is this possible for me? You've tried diets before, they didn't work, or at least maybe you struggled to stick to them to really see any benefits. And to understand this, we need to look at the science, because there are 3 scientifically proven ways to reverse diabetes. And they're all rooted in the same principle, which is helping your pancreas to work better and improving your body's ability to process sugar. The first method is bariatric surgery, often recommended for people with severe obesity. And this surgery changes the way your body processes food, leading to dramatic improvements in blood sugar control. And while it can be effective, it's a major surgery with risks, so it isn't suitable for everyone, and it's certainly not available for everybody on the NHS. The second method is a very low-calorie diet. These are the shake diets, where you eat as little as 600 to 800 calories a day for a set period. Studies have shown that this can lead to significant weight loss and improvements in your blood sugar. Let's be honest, this approach is hard to sustain, and it's not something I personally recommend for long-term health. And then the third method that's proven scientifically, and my personal preference, is the low-carb or ketogenic diet. By reducing the amount of carbohydrates you eat, you lower the amount of sugar entering your bloodstream. It's simple, it's focused, and it helps your pancreas function better and therefore process sugar more effectively. It is sustainable, it's effective, and it does not require extreme measures. Because the common thread in all of these methods is reducing the strain on your pancreas and improving your insulin sensitivity. And the best part? Doesn't need to be as restrictive, joyless diet in order to see results. You can adapt and tweak to fit your lifestyle. Now, I know people might still be thinking, this sounds great, but does it actually work in practice? Well, actually, let me share some stories from my clinic. One of my patients came to me with a HbA1c of over 100. She was on 3 different medications and injecting insulin daily. What we did was help her to understand how to eat in a way that allowed her pancreas to rest, to heal, while still feeling full. And examples of suggestions was swapping sugary snacks for nuts or going for short walks after meal. And this lady brought her HbA1c down to 54 within 6 months. And that was being off insulin completely. Another patient was just tipping into the pre-diabetes range with a HbA1c of 42. She wasn't on any medications yet, but wanted, of course, to avoid them. So by adopting a low-carb diet and making time for meal prep, she reversed her pre-diabetes in just 3 months. And these are real people from all walks of life who took control of their health. And if they can do it, well, so can you. So now that we've explored the science behind reversing diabetes and heard some of the success stories, you might be feeling a bit more hopeful. You may also be feeling a little bit skeptical, and that's completely normal. There are so many misconceptions out there about diabetes, what it means to reverse it and what it takes to get there. These myths can hold people back from even trying, and I want to take a moment to address those head on. So let's break down some of the most common myths about reversing diabetes and uncover a different perspective. Because once you understand what's really possible, you'll see that this journey is within your reach. The first myth is that I need to reverse diabetes completely to see health benefits. Not true. Even small improvements in your blood sugar can have a huge impact. Remember, lowering your HbA1c by just 1% reduces your risk of complications by 21%. So every step forward is a step towards better health. We need to move away from this idea of a perfection mindset. The second myth I hear very commonly is that it's too late for me. I'm already on insulin and loads of tablets and my age is against me. Actually, no. Many of our patients have come off insulin entirely just by lifestyle changes, and it's never too late to start. Never assume that you can't get function back. Yes, it's harder to recover all of the function of the pancreas if you've been diabetic for a long time, but do not use this as an excuse. And by the way, if you are on insulin, never attempt this without medical supervision. This is why I've created my clinic, because I want to help people decrease their tablets and insulin safely. You do need expertise to do that right. And that third myth then, and this is a big one, reversing diabetes means giving up everything that I love. And that's huge, isn't it? Because all humans love sugar. Evolution has primed us to seek it out. But honestly, this isn't about deprivation. I have never told a patient they can never have a treat again. never have birthday cake or not enjoy your holiday. Honestly, let go of that notion. However, you do have to be sensible, balanced, and find a way that you can sustain this for the long term. If you cannot see yourself eating in this way in 5 years, then don't start that method now. Too many of us focus on the short term, but it's the long term that really makes a difference to health, of course. So if this video has inspired you to make a difference to your health, to look at the potential of reversing your diabetes or pre-diabetes, then I've got loads more for you. I've created a hub full of free resources to get you started. You'll find more videos like this one, blog posts, and even downloads. In fact, I've got a live session with me coming up. So if this resonated with you, make sure you click the link to join. Thank you for watching, and I shall see you in the next video.